so much for waking up with us, doctor. Why is it important for patients with hypertension to use self-monitoring blood pressure devices regularly?
Yeah, really great question. So we've known for a long time that high blood pressure or hypertension is the silent killer. And what we mean by that is that people often don't know they have high blood pressure until something catastrophic happens, like a heart attack or a stroke. And so we think it's real important for people to know their numbers, to measure their blood pressure. You can get it checked at the doctor's office, you can get it checked at a pharmacy, at the gym, even at a kiosk in a local grocery store. And people can even monitor their blood pressure at home using a validated device. And as people see that their blood pressure is elevated, that's the time to talk to your doctor about it. Maybe make some lifestyle changes in diet or exercise to bring it down, or, if necessary, to be on medication for it. So that's why we think it's so important. We really want to prevent those heart attacks, strokes, and other complications. Some of the over-the-counter medications may have adverse effects. I think there's this sense that if you can buy it over the counter without a doctor's involvement, it must be perfectly safe. And most of them are. They have to meet a certain standard to do that. But for some people, especially people with high blood pressure, some medications can pose a problem. We worry most about some of the over-the-counter pain medications, especially the group of medicines called the NSAIDs, that's non-steroidal anti-inflammatory drugs. And it includes certain medications like ibuprofen or naproxen and many others. And those can, especially if you take them over time, and in higher doses, those can lead to kidney problems, and they can also raise the blood pressure. And so your doctor may recommend an alternative to those medicines, like acetaminophen, for example, which has less of that kind of an effect. Similarly, some of the over-the-counter cold and flu medications have stimulants in them. Those stimulants are good at clearing the nasal passages, but they may put extra pressure on the heart and the blood vessels, and they can directly raise the blood pressure. And so when choosing a cold medicine in the pharmacy aisle, you can see that some of them are labeled as being safe for people with high blood pressure, whereas others are not. And so choosing one without one of those stimulants in it is generally a better idea for people with high blood pressure. People can get more information about this and other issues related to cardiovascular disease and stroke at the American Heart Association website, which is easy. It's heart.org. And specifically to learn more about blood pressure issues, you can go to heart.org/BP tools. The BP is for blood pressure. So heart.org/BP tools for more information.